Hi, I'm Tara Schmidlin, one of the CPMC genetic counselors. Before you view your results, I want to give you some information about what the results can and cannot tell you. When viewing your results for any condition, it is important to remember that the testing done as part of the CPMC study only looks at disease risk. CPMC test results are not a medical diagnosis. Colorectal cancer is a cancer that occurs in the lower part of your digestive system, the large intestine or colon, and the last 6 inches of the colon, known as the rectum. Most colorectal cancers begin as small, non-cancerous growths called polyps that cause few, if any, symptoms. Over time, some polyps become cancerous. Colorectal cancer is most common among people over the age of 50. 5%, or 5 in 100, men and women will be diagnosed with colorectal cancer at some point in their lifetime. Colorectal cancer is the third most common cancer among men and women of all races. There are many factors that make up your overall risk for developing colorectal cancer, some of which you can control and some of which you cannot control. The primary risk factors for colorectal cancer include being over the age of 50, being African American, having a personal history of colon polyps, having a family history of colon polyps or colorectal cancer, having diabetes, having an inflammatory bowel disease like Crohn's disease or ulcerative colitis, eating a low-fiber, high-fat diet, not getting enough exercise, being overweight, smoking, heavy alcohol consumption, having radiation therapy for a previous cancer in the abdominal area, and genetics. We mentioned that genetics are a risk factor for colorectal cancer. The majority of colorectal cancer cases are caused by a combination of multiple genes, lifestyle factors, and the environment. It is estimated that about 35% of the risk of colorectal cancer in the Caucasian population is due to differences in genetic risk factors, while the remaining 65% of the risk is due to differences in non-genetic risk factors. In some cases, genetic variants can have a very large impact on the risk of colorectal cancer. These genetic variants are rare and do not account for the majority of cases of colorectal cancer. The CPMC research study is not able to test for these rare genetic variants. The CPMC study only looks at common genetic variants that have a modest effect on your risk. You may be at risk of having a rare genetic variant if you have a family history of early onset colorectal cancer before age 50, 2 or more family members with colorectal cancer, or endometrial or uterine cancer diagnosed at any age. A CPMC genetic counselor can help determine if you should consider additional testing for a rare genetic variant associated with a high risk for colorectal cancer. CPMC genetic counselors can be reached via email at cpmcgc@coriel.org or by phone at 888-580-8028. In the early stages of colorectal cancer, people often do not experience symptoms. Symptoms can vary depending on the size and location of the cancer and can include diarrhea, constipation, rectal bleeding or bloody stool, abdominal pain, abdominal cramps, gas, pain during bowel movements, a feeling that the bowel doesn't completely empty, weakness, fatigue, and weight loss. Talk to your doctor if you're experiencing any of these symptoms. It is not possible for colorectal cancer to be diagnosed by genetic testing. Colorectal cancer must be diagnosed by a gastroenterologist using blood tests, colonoscopy, or imaging tests like X-rays or CT scans. There are a variety of screening tests available that can detect colorectal cancer. The American Cancer Society recommends that everyone begin screening for colorectal cancer beginning at age 50. Individuals with a personal or family history of colon polyps, colorectal cancer, inflammatory bowel disease, or those at risk for rare genes associated with high risk for colorectal cancer should talk to their doctor about screening more frequently. Colorectal cancer screening tests are one of the key tools in preventing colorectal cancer. A colonoscopy can detect and remove polyps, which, left untouched, could progress to colorectal cancer. In addition to colorectal cancer screening, changes in your everyday lifestyle can also help lower your risk. Eat plenty of fruits, vegetables, and whole grains to increase the amount of vitamins and minerals you consume. Eat fats in moderation, especially saturated fats. Consume alcohol in moderation, stop smoking, and be sure to get regular exercise to help maintain a healthy weight. Now let's talk specifically about the CPMC results and genetic risks for colorectal cancer. Studies have shown that a particular genetic variant, called RS6983267, is associated with an increased risk for colorectal cancer in people who have 1 or 2 copies of this variant. This variant is relatively common in the population. Remember that we all have 2 copies of every gene. We inherit 1 copy from our mother and 1 from our father. This means that for every genetic variant the CPMC study looks at, you can have either 0, 1, or 2 copies. Your CPMC results will tell you how many copies of this risk variant you have. Your colorectal cancer results tell you about the impact of a risk variant on your risk to develop colorectal cancer. Having 1 or 2 copies of this risk variant increases your risk of colorectal cancer compared to individuals who have 2 copies of the non-risk genetic variant. Having 2 copies of a non-risk genetic variant means that your risk to develop colorectal cancer is lower compared to individuals who have 1 or 2 copies of the risk variant. Remember, colorectal cancer is a complex disease, which means that it is caused by a combination of variants in multiple genes and the environment. No single genetic variant causes colorectal cancer, so no single genetic variant will completely predict your risk for colorectal cancer. Rare variants exist that are associated with a high risk of colorectal cancer. The CPMC does not test for these rare genetic variants. Results of CPMC testing alone do not diagnose colorectal cancer or rule out the chance of developing colorectal cancer in the future. Genetic variant information can help estimate your risk of colorectal cancer. However, other risk factors like your family history or lifestyle may have a greater impact on your risk than any individual genetic variant. We may learn of other genetic variants that influence your risk of colorectal cancer in the future. As we learn more, your estimated genetic risk for colorectal cancer may change. We'll keep you updated on changes through the CPMC web portal. For more information, consider sharing your CPMC results with your healthcare provider. You can also contact a CPMC genetic counselor, read information on the CPMC health condition page, or attend a CPMC educational event.